The Second ECOWAS Conference on Lassa Fever has ended in Abidjan, Côte d'Ivoire, with a commitment to advance recommendations on upscaling the activities of the WAHO Regional Centre for Disease Surveillance and Vaccine Development towards effective control of Lassa fever in West Africa. Kelvin Ewonaye reports.
4 days of intense conversations, scientific presentations on diverse areas of Lassa fever research and evaluation of disease surveillance patterns by a gathering of over 500 scientists and policymakers have now put member states of ECOWAS on a better footing to not only design a better Lassa fever response strategy, but the establishment of a regional policy and action plan to combat the impact of the disease, seen as one of the most devastating health challenges in the sub-region. Now referred to as the Abidjan Momentum, the framework also encompasses a place for traditional medicine research and application for the control of the disease.
Expected resolutions will guide our policy framework on tackling Lassa fever control. We at WAHO will continue to support the national and regional efforts aimed at building resilience of our communities.
Of significant note at the conference was the activation of ECOWAS Young Researchers Platform, designed to encourage and support new generation of researchers in Lassa fever and other infectious diseases, with Nigeria's Aziz Moshood shining brightly and clinching the top prize in Best Porter category.
As a medical lab scientist, to diagnose Lassa takes a day, 2 days, 3 days. We need point of care testing where a patient will be presented to the lab and they will be able to know exactly, immediately, that this patient has Lassa.
How do we make sure that the solutions that we're creating are really coming from the region and that regional colleagues, national colleagues, whether with the universities or research institutions, are not working in silo or are not just beneficiaries, but they're actually co-designers.
Before the next conference, it is expected that a lot would have been achieved and implemented from the resolutions here, with firm focus on vaccine development.